Bare. What do you mean by bare? Like bare means what you like think about like when you say bare hand. I will punch you with the bare hand, which means ki a naked hand. What is it like? No, I will put a gloves, then I will punch you. So now hand is not bare. So when I'm talking about a bare liver, that means there is a no peritoneum. Okay, clear with this. Okay. Now you see this shape, this shape. So here, this shape. So these two peritoneum now are going to form two ligaments, coronary ligaments and triangular ligaments. Now these two things will form these two ligaments, and these two ligaments will found in which surface? Diaphragm surface. So which surface? Superior surface. Got it? Yeah. Now you got it. So now when I'm talking about your ligament, like come on, ligament is also hair. So it is made of peritoneum, no connective tissues. So even though there is some nomenclature, like don't confuse with this nomenclature. Okay, so this is our ligaments. And now when I say coronary ligament, coronary artery, nah, it's hair, heart. This is different. Okay, so coronary ligament. So what I was tell you here, the origin of the ligament. The origin of the ligament is what? The origin of the ligament is peritoneum. Okay, if you have any questions regarding this peritoneum, or if you want a full lecture in this peritoneum with more details, you know what to do. Comment down it. Now, there is another thing we have to remember. When I say this is liver, now this is esophagus, and this is our stomach, this is abdominal esophagus. Huh? Now when I told about balloons, this is anterior surface. Okay, one balloons, another balloons from, you know, there is a gap here, which is normally a gap present. So think about this, try to visualize it. So balloon from posterior and anterior, balloon cannot fuse here because here is liver, cannot fuse here because here is stomach, but can fuse here because there is nothing. Nothing. So when these two layers fuse, like this is also known as something, but this is not ligament, this is called omentum. Again, there is many terminologies in peritoneum. When we say something like omentum, something like ligaments, something like mesentery, a mesocolon. So we'll go there, don't worry. So now, in between the liver, the inferior part of the liver and the lesser curvature of the liver. Okay, if you don't know, this is greater curvature, this is lesser curvature. So, and the inferior border will get this kind of peritoneal structure, which is known as lesser omentum. Sir, lesser omentum, how to remember thing? Again, it attaches to the lesser curvature to the inferior border of the liver. Okay, just liver. Lesser curvature to liver, lesser curvature, lesser omentum. Now you got it. And okay, we got here something which called epiploid foramen, which is not relevant right now. I don't know why I said it, but you just got it. It helps. I told you now. There is two balloons. One is anteriorly, one is posteriorly. Now with this foramen, these two balloons are connected. Just remember this point for at least now. So here we got our lesser omentum. So when I was talking about peritoneal relation, from anteriorly what we saw there is a lesser omentum which is attached with the stomach. Then we have our Our diaphragm. So our diaphragm, so it has to attach with something. If a liver will not attach with something, now what will happen? Liver is here. No, liver will be good there. Will be good there. Will be good there. We even don't know where will be the real location of the liver. We have to perform some ultrasonography X-ray. Something. So we are attaching. We are fixing this liver. So think about like this. From this diaphragm, we are fixing. We'll fix it. Like how? So how? You got it. We got here peritoneum, and there is two things. One, we say the coronal ligament and the triangular ligament. And when I said ligaments, you know that this is peritoneum. So these two peritoneums are helping this liver to attach with the diaphragm. So now liver is fixed with the superior part. You know that. Now we are going to make liver fix with the anterior part. Yeah. Now I already told you there is a falciform ligament. Again, if there is any ligament that is made from peritoneum. So this falciform ligament, so this is what surface? You have to know surface, This is our anterior surface. The anterior surface will attach with what? Come on, when I'm telling you six packs, okay, it has nothing to do with six packs. I just want to tell you it is our abdominal wall. So don't confuse and say someone, our liver it attached with six packs of via the falciform ligament. That person will get, come on man, it's not like that. So with the anterior abdominal wall, falciform ligament. Now we attach with superiorly, we attach to with the anteriorly, and here with the visceral organ we attached with our lesser omentum. So this is the main thing. In posteriorly, if you see, there will be, when we say this, what? Inferior vena cava. So here is also peritoneum which helps to attach, otherwise you got it. So this is our what? Peritoneal relation. Now the visceral relation. Visceral relation is easy. Why? Because I already told you when I was teaching you this surfaces. I already told you. Try to visualize it. I am not going to write. Okay, I will just try to help you by visualizing it. Superior surface, with the diaphragm. Anterior surface with the anterior abdominal wall. Right surface of the liver with what? Ribs, lungs, and in between those visceral and parietal pleura. Okay. And when we go according to the surface, now we got our inferior surface, not inferior, visceral surface. I will draw it. And in the posterior, the posterior wall of this abdomen. And the left, okay, so that will come actually in visceral. Now talk about the visceral. So you got, when I talking about visceral means organ, visceral organ. Now see the visceral surface. Okay, so before going in diagram, now let's try to visualize it. With respect to our bodies. Here is what? Sternum. So mid-sternal line. Mid-sternal line. Here is our xiphoid passes and this joint with the sternal body. Now think about it. Approximately, if you take this joint, in the right side is right lobe. In the right side is right lobe. In the left side is left lobe. Approximately, you can think about it. Now think about it. Okay, I hope you guys already know. Okay, right lobe, left lobe. You know what is here? Stomach. You don't know? Just know for now. This stomach. Here we got something, spleen. Here, and here what we got? Kidney. What is the cap of kidney? Suprarenal glands. Again, what we got here? kidney and suprarenal gland. What we got here you what ascending colon, and then transverse colon and colonic flexure, right? Colonic flexure. So if you just think about the normal anatomy or the location of the organ, you can easily tell, like what you can tell. Left lobe of the liver is touching what? Is touching stomach. Come on, here is our spleen and kidneys, and this is our nipple. It's not going there, so the liver is not going to touch those organs, right? It's only going to touch the stomach. Now come here in the right lobe. The right lobe, it's a big one. It's going to touch everything. So let's try to visualize what we have, which visceral organ we have. We have kidney, it will touch. We have which kidney, by the way? A right kidney, it will touch. A right suprarenal gland, yeah, it will touch. A little bit of colons and colonic flexure, yeah, it will touch. It will touch. So we have here something called C-shaped duodenum. You were right, it will touch. So the right lobe. So at least you have a visualization, or at least you can think logically. Right lobe is touching which visceral organs and left lobe is touching which visceral organs. Now come to the diagram of the visceral surface, or how we are going to visualize those things. Okay, for simplicity's sake, did you guys notice it? I don't know whether you noticed it or not. I always make this little depression. I can make like this, but I didn't make like this. I make like this. Why? Why I did this? Because in the inferior surface, there is gallbladder. There is gallbladder. There is gallbladder. And gallbladder also has a depression on the what? Liver. That's why I always make this little notch. That's why I'm telling you, try to draw. The more you draw, the more you get perfectionist, something like that. So draw it. Okay, I'm going to do something like this because I will tell you a good concept, a clinical oriented concept, something like that. Okay, remember me. Okay, now this is our liver. In posterior surface, we know there is some virtual line. So when you make a diagram, just don't copy it from a book. Okay, try to make sense. When I'm taking a straight line, you will not find this kind of straight line in any books. You just have to make it by yourself, because you are going to understand. Nobody gives a shit about that. You should understand what you are drawing. You should understand what is here. That should be your main focus. When I do like this, Clara is portal pride. When I do like this, I know this is gallbladder. When I do like this, I know this is inferior vena cava. So you should know, make it as simple as possible. So now in the left side, like when you draw the stomach, you first draw like this. Then you draw the what? Pyloric region. Then you do what? Duodenum. So try to figure it feel it like you are just drawing a drawing of the stomach. So start from here and start to draw the way I draw. Okay. Now here is some base, the colon. Now think about this. Okay, here is our kidney and here is our suprarenal gland. So if you draw it like this, you will get it. So we got some impression of liver, impression of stomach, some pylorus, duodenum, colon, white kidney, and suprarenal gland. Clear? Okay. Now come to here. Now think. This is our anterior abdominal wall. This is our umbilicus, and for now this is our liver. This is not anatomical diagram, it's to just understand you. You know that when we are in embryo, means when we are intrauterine life, we got our nutritions, all the nutritions from our mother via these umbilicus, and which is the point is here umbilicus. So here we got our umbilical ligamentum, what teres, round ligament. So when I say you like this falciform ligament, and I told you here is in structure, and now it going up back. Now think about it. Now it's going from here, it's coming here. Now it's coming here. So when you talk over here, ligamentum teres, ligamentum venosum, this is the same vein actually, but actually it's the intrauterine line. Then it comes here and come to this inferior vena cava. And for some reason, when you say medusa, something like that. So now think about this. If there is, for any reason, there is a buildup of pressures, this channel will start opening. Portal hypertension. This channel will start opening, and comes to this umbilicus. So around this umbilicus, you will get this venous impression. What do you mean by venous impression? If you see here, something like bluish color, venous impression. So around this umbilicus, you will got this venous impression. So in anterior view, these kind of veins you can sometimes see. Clear for now? Yeah. For now, this is a little bit, because that's all time I got for right now. In the next part, we'll discuss about the remaining topics. Okay, so thank you guys. Please share this and like this channel, and if you have any questions, comment down below. If you want some other topics, comment down below. If you don't understand, comment down below. I will try to explain in the next videos. Thank you.